To Healthy People 2020, health disparity is a health difference that is linked to social, environmental, and economic disadvantage. These are avoidable gaps between and within communities. Our research focuses on the health disparity experienced by the urban poor and the ways in which they manifest. As mentioned before, environmental disadvantage plays a large role in the disparity that people within urban communities face today. This includes, but is not limited to, factors such as proximity to healthcare facilities as well as food deserts. According to factors associated with closures of emergency departments in the United States by Renee Shah, the number of hospital-based emergency departments in United States urban communities declined 27% between 1990 and 2009. This creates a physical barrier between the urban poor and medical treatment. A majority of the urban poor live in areas where there is a lack of access to grocery stores and foods of nutritional value. These areas are referred to as food deserts and is a large contributing factor to illnesses such as diabetes, obesity, and heart disease that many urban poor face. A year-long study done by the U.S. Department of Agriculture found that 15% of the U.S. population that live in low-income urban areas live more than 1 mile from a supermarket. Disadvantages such as lack of access to healthcare facilities and food deserts are characterized by social inequality. This is reflected in evidence of people from disadvantaged social backgrounds being more likely to experience certain illnesses, to become ill, and to have blocks in access in comparison to their counterparts of higher socioeconomic statuses and social standings.
Next, let's talk about the quality of care people living in poor communities get when they have health insurance, whether that be through Medicaid or some other health insurance company.
There are means for people living in impoverished communities with low income to receive health care, but many question the quality of care they receive due to the insurance they have. Being shown is an incident that happened in Baltimore earlier this year when a woman was left out in the freezing cold by hospital staff workers. This is known as patient dumping, where a hospital releases a patient to the streets rather than keeping them or giving them the needed social services they require. After seeing this, more people are wary of receiving Medicaid because they are afraid that when they need care, they won't be treated properly. Yet the government is practically forcing this program to people with low income. Instead of helping the people in need, it is actually hurting them. Medicaid fails the poor, and without changes being made to the policy, it will continue to fail the poor for many years to come.
I'll be discussing how current racial and ethnic income disparities are determined by the level of education people receive. First off, there's a correlation between the amount of education and schooling that you get and the money that you'll earn and the wealth that you can accrue. This is important because people with family income that's higher have better odds of sending their children off to college who can then create a living for themselves. Education is also a determinant of your health outcomes, such as life expectancy and the likelihood of acquiring chronic diseases. People with less education actually experience earlier onset chronic disease at higher rates than people who receive higher education. And lastly, these disparities are marked by racial and ethnic variation, such as Black non-Hispanics and Native Americans who receive less education, experiencing more health disparities than whites and Hispanics.
Is it possible to enact change in such a corrupt and broken system? And if so, how can we change a system that's been so deeply rooted in inequality? It is possible to enact such a change. For instance, if we fight harder for proper health education in school curriculums, we will enable the younger generation with the proper resources they need to access health care and to maintain their overall well-being. Another means to enact this change is to vote. We need to find politicians willing to fight for a universal healthcare system. Last year, 60% of Americans believed that we should have a universal healthcare system in the United States. Other countries have implemented a successful universal healthcare system, so why haven't we? If we use our voices to be heard, we can create a system that benefits everybody and leaves nobody behind based on their socioeconomic class.